From our 22 News Broadcast Center, this is 22 News in Focus.
Good Sunday afternoon and welcome to 22 News in Focus. I'm Laura Hutchinson. February is National Heart Month. You may have heard of the Go Red for Women campaign. That's a campaign designed to raise awareness of heart disease, which is the #1 killer of women. But it's not just women who have to be careful. According to the Centers for Disease Control and Prevention, heart disease is the leading cause of death of both men and women here in the United States. The good news is it's preventable, and that's where 22 News in Focus comes in today. Today we'll talk to a Bay State Medical Center doctor about who is susceptible to heart disease and the most effective ways to protect yourself. Then later we'll hear from a woman who is a 2-time heart attack survivor. We'll find out what her symptoms were and how she's staying healthy now. But first, let's begin today with Dr. Quinn Pack, a preventative cardiologist with the Bay State Heart and Vascular Program. Thank you so much for being here. I appreciate it.
No problem. Glad to be.
You know, many people may be surprised to hear that heart disease is the #1 killer. You know, you hear about cancer a lot and some of these other issues. What makes this so problematic? Why is this so widespread?
Well, you know, heart disease is really almost a manufacturing of our current environment. So our current environment, we sit, we smoke, we eat too much, we drink too much. And so some of it has been manufactured. Some of it's also our genetics. But we know that there are a couple of very important risk factors that lead to heart disease. And if you don't have them, you don't come down with heart disease.
So what are those factors? You know, someone might say, well, this doesn't run in my family, so I don't have to worry about that. What would you say to those people?
Yeah, so family history is only one of the important risk factors. And if you have a family history that's unfortunate, you can't change your genes. But you can make sure that you don't smoke, right? Smoking is the most important thing. It's not just lung cancer. It's not just emphysema. Smoking causes heart disease. It causes vascular disease. Diabetes, very common cause of heart disease. And diabetes usually results from obesity. So if you're overweight, you need to lose weight. You need to make sure you don't have diabetes, and that'll help prevent a heart attack. Same thing, high blood pressure. Another very common risk factor, very treatable. So if people will go to the doctor and get their blood pressure checked, get on good medicines, that'll help reduce their risk of heart disease. So hypertension, smoking, diabetes, very common risk factors for heart disease that are all very preventable.
How about age? Does that factor into this at all? Is this, you know, you hear about, you know, women when they hit a certain age and, you know, they need to start getting checked for breast cancer.
Right.
Is this one of those things where women or where age is a factor in this?
Yeah, so unfortunately, age is a factor in heart disease. Most people don't have symptom onset until their 60s, 70s, or 80s. People who have a heart disease in their 30s and 40s, that's really an important thing to watch out for. They've got a more aggressive disease, but most of the time it's in the 60s, 70s, and 80s. Women, because of the female hormones, are actually protected from heart disease for about 10 years, but then late in life they catch up. So men tend to have heart disease sooner in life, in their 50s, 60s, and 70s. Women seem to delay by about a decade. But eventually they catch up.
Right. So what are the warning signs? If somebody is feeling a certain way, you know, you hear about the stereotypical pain in your arm and, of course, in your chest.
Right.
So what are some of these early warning signs?
So any chest pain, this is what I tell patients, any pain or a discomfort sort of from the waistline to the jaw, all the way down to the mid-elbows or even the wrist, that comes on with exercise and gets better with rest, that is something you need to talk to your doctor about. And any pain that is in the chest that's severe, associated with sweating, shortness of breath, pain in the shoulder, that's something that you need to go to an emergency room right away. But anytime you have discomfort in the chest with exercise, that's a big warning sign to get in and be seen by a doctor.
Now, is it possible to have a heart attack but not feel those warning signs?
It is. We call those a silent heart attack or silent MI. It does happen. It's not the most common thing, but it does occur, and it typically tends to be people who are elderly, women, or with diabetes. those three conditions sometimes help mask the sort of standard classic chest pain symptoms.
Okay, when we talk about this Go Red for Women campaign, you'll hear things like know your numbers and all
Right.
that. And I want to find out more about what that means, as well as what you can do if you're dealing with heart disease or a loved one. So I think we're going to take a short break and we'll continue and talk about some of these preventative measures that you can take. Stay with us. You're watching 22 News in Focus. Welcome back to 22 News in Focus. February is National Heart Month, so today we're talking about ways to protect yourself and loved ones from developing the disease. We're continuing our conversation now with Dr. Quinn Pack, a preventative cardiologist with the Bay State Heart and Vascular Program. Thank you again for being here. When we left off, we were talking about this phrase that people will hear throughout the month, know your numbers. What exactly does that mean? What sort of numbers should you be aware of?
Yeah, so ultimately, right, what we really care about is how healthy you are, and there's no exact cutoff. But the standard numbers that we talk about that have been used to define someone who's at higher risk versus someone who's at lower risk are numbers that focus around cholesterol, around blood pressure, and around weight. Obviously, you shouldn't smoke. That's a yes or no. Okay. But as far as cholesterol goes, most people should have a total cholesterol less than 200. And then an LDL, which is a bad cholesterol, less than 100. And if you've already had a heart attack, those numbers should be even lower. If you have high blood pressure, we use the cutoff of a systolic blood pressure of 140 millimeters of mercury in most people. Some individualization in that, particularly for patients who are over the age 80, maybe the number should be 150. So that's blood pressure and cholesterol. And then for diabetes, we use a marker called the hemoglobin A1C. That should be in the 7 to 8 range or lower. And then lastly, as far as weight goes, we talk about the body mass index. And for someone who's not familiar with the body mass index, it's a ratio of your weight to your height, measured on a scale from about 15 to about 40. A body mass index above 30 is considered obese, and a body mass index between 25 and 30 is overweight. And so this is a formula you can go on to almost any website. It's in most doctors' offices. You can figure out about where your weight is. And many people describe themselves as overweight, and maybe the medical term to describe that is obese.
Okay, so it sounds like it's not one size fits all. You really need to be aware of yourself. So what questions should you be asking your doctor when you have this?
So your doctor can take your individual numbers, your blood pressure, your cholesterol, your weight, your height, your hemoglobin A1C, or the presence of diabetes, and put them into an online calculator. It's actually called a risk calculator, and you can come up with your 10-year risk of having a heart attack. Anyone who has a 5% risk of heart attack is considered at low risk. Anything higher than that, you should definitely talk with your doctor about getting onto medicines. But this is something that someone who's at home, who knows their numbers, can do on their own, and they can either pat themselves on the back or they can start worrying and go see their doctor.
Okay, and some of these preventative measures, we've heard you say not smoking,
Right.
Limiting drinking, or doing away with drinking. What are some of these, what are the best ways?
Yeah, so if you smoke, absolutely you should stop. The first and most important risk factor, and actually I like to treat people who smoke, is that once you quit, it's gone, right?
Right.
It's easier than weight, because once you've gained weight or lost weight, you're likely to have it come back. It's a daily struggle. And with many smokers, it's a struggle. But once you've quit smoking, it's beautiful because it's really gone. As far as a diet, we talk about that. I would encourage people to look up the Mediterranean diet. The Mediterranean diet is really different than the Western American diet in that it emphasizes fish, olive oil, nuts, beans, and other legumes, in addition to the standard fruits, vegetables, and whole grain. And then really limit your red meat once a month, honestly. And then moderate amounts of alcohol, maybe one standard drink a day or less, would be a healthy diet. And then with exercise, the standard guidelines for exercise is 30 minutes of moderate exercise every day, or at least 5 times a week. And if you can't do 30 minutes, then do 10 minutes. Maybe do 10 minutes twice a day, or 10 minutes 3 times a day. And it doesn't have to be in a gym. the best exercise for a 7-year-old is a good brisk walk. For a 50-year-old, it might need to be a jog or something. And then for the 20-year-olds, go out and play some basketball. You know, but have fun with your exercise. Make it sustainable.
So one thing that we deal with this time of year is, you know, people getting out shoveling. There's always a concern about the impact that that can have on, so you hear about people having heart attacks while they're out shoveling. So how do you not overdo it when we talk about exercise or getting out and doing something active? How do you not overdo it?
Yeah, you know, for people who have had a heart attack, shoveling snow is probably the only exercise that I give any caution for. We know that exercise is good for the healthy heart, exercise is good for the damaged heart after you're through the hospital and that you've had a heart attack, and actually exercise is good for the failing heart, for people with heart failure. But for some reason, something about being out in the cold, doing heavy lifting, in many people who haven't exercised in several months, that does seem to set off a heart attack. So if you've had heart disease, I would caution you about shoveling snow. Maybe get your nephew to do it.
Yeah, it's just too much sometimes. And what about stress? Does that add into this at all?
Absolutely. The stress is an important risk factor for heart disease, particularly people who have a lot of anger or a lot of aggression. That seems to be an important risk factor for triggering a heart attack. For people who are stressed, I strongly recommend exercise. It's been well proven in many studies to reduce anxiety and stress levels.
Now, many people might be watching this who have a loved one who's already suffered from heart disease, so they're wondering what the takeaway is for them. You know, depression, I know, can be an effect after you or a loved one has had a heart attack. You don't know what you're allowed to do socially. You know, you don't want to fall off again here. So how do you handle that after the fact if you've already fallen victim? Or
if you've already had a heart attack, first thing to know is that depression is very common. So you don't need to beat yourself up about it. If you feel down or blue, a lot of that's, we sometimes call it an adjustment disorder, but sometimes it's worse than that. It's major depression. And anyone who has serious feelings of blues or depression should absolutely go see their doctor and get started on medicines. It's okay. At the same time, cardiac rehabilitation for people who have had a heart attack, it's a program of exercise that's monitored by exercise physiologists, helps treat depression. Exercise is a good treatment for depression. Visiting with your doctor, connecting with your loved ones. But withdrawing into a shell will not likely help get your depression better.
Okay, and how often should someone see a doctor to be on top of these numbers that we're talking about?
Yeah, the American Heart Association and other groups recommend getting your cholesterol checked no less than once in every 5 years.
Okay.
Your blood pressure, you can check that at a local grocery store or pharmacy. And that should be checked probably about once a year. And if those numbers are abnormal, then we need to start monitoring more often. I think people should weigh themselves on a daily basis so that they know where their weight is going and they're not surprised.
Okay, Dr. Quinn Pack, thank you so much for coming on and talking to us about this very important subject. Really appreciate it. Bay State Medical Center cardiologist, thanks for being here. And when we return, you'll hear one woman's story of recovery after her heart attack. Stay with us. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we're talking about heart disease. We just finished up talking to a Bay State Medical Center cardiologist about the signs of a heart attack and how to stay healthy and prevent it. Joining us now is a woman from Chicopee who knows all too well about the importance of paying attention to your heart health. This is Sharon Oziak, a heart attack survivor and one of this year's Go Red leading ladies of Western Massachusetts. First off, congratulations on that title, because that means that you're a survivor and you're doing well today. So it's so nice to have you here.
Thank you for having me.
If you would, just share your story with us. I know you've been down quite a road. When did this start?
Well, last February 26th, I woke up in the morning having a lot of difficulty breathing. I had no symptoms prior to that, except congestion like bronchitis. I had gone to the doctor. That's what they told me I had. I asked my husband to please take me to the hospital because I really couldn't breathe. When I got there, they told me that I was having a major heart attack and then I needed to get to the cath lab at Bay State Medical Center immediately so that they could see what was going on. I don't remember much of what happened once I got in there. But when I woke up, they told me that they put in 2 stents into my artery in the front of my heart. They'd also told my husband that I had a previous heart attack and that the right artery was completely blocked. Now, I never knew about that heart attack, and I never had any pain with the second heart attack at all. Nothing. It was like I had a cold.
Wow.
So to say I would run to the hospital and say I'm having chest pain or arm pain, I wasn't. I just couldn't breathe. I mean, it progressively got worse as I got there, but so after the stent placement, I stayed in the hospital for a few days. I then went home. 2 days later, I had difficulty breathing again, and they found out that I was having some kind of fibrillation in my heart, and that the electrical contacts, I guess, weren't going to the other side of my heart. And they had to defibrillate me in the emergency room, and that didn't work, and then they gave me medication, and that helped. My heart rate was 210 beats a minute.
Wow.
And so at that time they decided to put in a defibrillator and a pacemaker. So I do have that in my heart now, and supposedly if anything happens it will give me a little shock and I'll be okay.
And this was just last year. So
this was last year.
Quite a road for you.
Yes, it has been, but actually a lot of it has been very rewarding. I've lost a lot of weight.
Wow.
I've learned
Can I ask how much?
60 pounds.
Congratulations.
Thank you.
How did you do that?
I just started eating right and exercising and worrying.
And stress. Yeah.
But I learned how to eat better.
Wow.
My mother was a wonderful cook. And so it was always good to have mashed potatoes and gravy because we were Irish.
Of course.
You know, but, and of course I feed my husband that way, so he better stop eating that way too. But now I eat more salads for dinner with chicken, and I might have fruit after. I drink skim milk. I only drink 1 cup of coffee a day. I'm very careful. And I've also learned to do that with my grandchildren so that they get a better idea of how to eat. I've eaten foods I've never eaten in my life.
Wow.
Tabbouleh.
Wow.
I wouldn't have known what it was, but I tried it.
And now what do doctors say? Are you doing well a year later?
I saw the doctor yesterday and he said that as far as he was concerned, I was doing fine. But I did have some questions, and so he said, well, let's do a stress test just to give you some assurance that things are going okay.
Does this run in your family at all? Did you have any indicators that this?
No one in my family ever had heart disease. And I also have diabetes. And no one in my family prior to me had diabetes. I now have a 46-year-old son who has diabetes and is overweight.
And are you sort of passing this message on to him
Well,
now?
I try, but you know, men are stubborn. So he has stopped eating salt and butter. So he's trying.
Now, I know that you were chosen as a leading lady for this Go Red for Women campaign. I know that you're really excited to be a part of that. Why?
It's an honor.
Tell me about that.
The girls at the Bay State Cardiac Rehab Gym nominated me, and I asked why. I said, there are many other women here that come as often as I do. He said, it's that you're so excited to come here and want to get better. Where they come, they chat, and you know, not that they're not doing what they're supposed to, but I put on headphones and I'm like pounding the treadmill to get better. I want my heart to be better. I know it'll never be what it was, but I can still live longer and live a happy life by taking care of myself.
I feel like this has been such a positive change.
They're so wonderful there, and they all are, they're so happy for me. And I want to get out in the community, and I talk to anyone. If they see my pin, I tell them what it's for, And I say, you know, if you feel anything that you think you might be having a heart attack, go to a doctor. Don't let it happen like it happened to me. It's very frightening, you know. But I had a very good experience at Bay State. And I do exercise daily. And I have so many avenues. I go to Bay State. If I can't make the times they have, my husband works for Loomis Communities, and they actually offer health programs at their facilities. So we go to the one in South Hadley. We use their pool and their gym.
So for people watching, what message would you send to them? You know, is there anything that you weren't doing before that now looking back in hindsight you should have been, you know, like we were talking about with Dr. Pack, you know, knowing your numbers, understanding where you should be. What would you say to those people at home?
I always knew my numbers because as a diabetic, you know, my doctor would always inform me what my A1C was. And at the time I had my heart attack, my A1C was 10.
Wow.
Which is really way off the charts.
Wow.
It is now 6.5. It's been that way for the whole year. And I would say try and eat better, stay away from red meat. I don't even like red meat anymore.
Sharon Oziak, you are such an inspiration.
Oh,
thank
well,
you
thank
so much
you.
for coming on and talking to us. And I know that this luncheon is Friday, February 27th. There are still tickets available. That's to support the Go Red for Women campaign and all the research. Thanks for coming on and talking to us.
Thank you.
And we'll have the last word for you after the break. Stay with us. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we dedicated today's program to National Heart Month, a nationwide effort to prevent heart disease and improve your overall health. We hope you heard something today that can help you or a loved one. That is our program for today. We want to thank our guests for joining us. Thanks to you at home for watching. If you've missed any of it, you can watch it in full on our website at wwlp.com. From all of us here at 22 News, we wish you a wonderful Sunday. Take care.